Welcome. Let's dive deep into Waterline test options available to dental offices today. There are two main types of testing. Lab or mail in testing requires sending your water sample according to specific directions to an outside lab. Result times are typically longer with outside testing. Results are quantitative. All result records are maintained by the lab and can be requested by others if necessary. As this testing is a professional service, it is more expensive than using an in office kit. HPC, or heterotrophic plate count, is the best known lab test. Testing is done in an ISO certified lab. The International Organization for Standardization ensures the test method is consistent with international standards so you can expect the same quality and results from any ISO lab. The EPA, or Environmental Protection Act method, indicates the specific rules for testing. In this case, APH A9215C must use R2A media incubated for 7 days at room temperature. R2A agar is a cultural medium developed to study potable water bacteria. It is the general food used to feed the bacteria in your sample. How does HPC testing work? The sample water is added to a petri dish with a food source. The bacteria present in the water sample feed on the food provided and grow colonies. The colonies are counted to reflect the number of live or viable bacteria in the sample at the start of the test. HPC is a pioneer in dental water testing, trusted for decades. It is accurate, detecting a wide range of microorganisms with quantitative results expressed in colony-forming bacteria units per milliliter. Using an outside lab requires more work and planning versus in-office testing. Samples must ship promptly within the same day collected and according to specific instructions. Ice packs need to be frozen prior to testing, forms filled out, and everything shipped in the correct protective packaging. Any deviations from these instructions could compromise the sample. The testing and results take 7 to 14 days if performed according to the standard method. This has nothing to do with how busy the lab may be, but the simple fact that it takes time for bacteria to grow. Even though HPC is an acknowledged and validated test, science continues to advance waterline testing, increasing the options available to us. New technologies reduce test time and increased accuracy. HPC uses R2A media, which is an excellent general food source. However, just like people, not all bacteria eat the same thing. If the bacteria do not eat, they cannot grow or form colonies. No colonies, no bacteria counted. HPC incubation time is approximately 5 to 7 days, meaning the bacteria present can grow colonies during this time. Any slow-growing bacteria present in the sample may not have enough time to colonize during the standard time. In both circumstances, some bacteria may not be accounted for, and this can lead to underestimated bacteria counts. You may wonder if you should worry about these unaccounted for bacteria. The answer is yes. One potentially hazardous slow-growing microorganism is Legionella. Legionella requires a very specific media to grow. It does not like R2A media. This is important to keep in mind because if you suspect a possibility of Legionella in your water lines, you must request a special test to detect it, not a standard HPC. Legionella causes Legionnaire's disease. We are all familiar with the 83-year-old Italian woman who died after contacting the disease at her dental office from contaminated aerosols. Be extra cautious with patients that are especially at risk. Recently, CDC, Centers for Disease Control and Prevention, published a health advisory about outbreaks of NTM infections and the importance of maintaining and monitoring dental water lines. NTM, or non-tuberculous mycobacteria, is a mixture of various slow and fast-growing bacteria. Note that not all NTM can be detected using R2A media, which means an HPC test may or may not detect them. Some slow-growing NTMs can take up to 30 days to colonize. This is well beyond the 7 days of typical HPC incubation. Candida auris and Aspergillus can take 5 to 7 days for colonies to form, which means there is a possibility these fungal microorganisms may not be detected with an HPC test. Invasive fungal infections can severely affect the blood, heart, brain, eyes, and other body parts. These fungi are extremely resistant to treatment, antibiotics, and antifungal medicines, which is especially concerning. Another challenge of HPC testing is based on the belief that bacteria are evenly distributed within the sample. HPC testing uses two samples with different volumes for each test to increase accuracy: 0.5 milliliters and 1 milliliter. The left row shows colony formation in the 0.5 milliliter sample, and the right shows colony formation in the 1 milliliter sample. The second row should show twice the colonies as the first row. As you can see, the pairs do not always reflect the same result, and therefore bacteria is not evenly distributed throughout. An alternative to regular HPC testing is modified EPA method 9215B. The benefits and challenges are the same as HPC. The main difference is the incubation is only 2 days at 35 to 40 degrees Celsius. Results have a quick 2 to 3 day turnaround versus the 7 to 14 days for standard HPC testing. Due to the short incubation time, only fast-growing bacteria are counted, which does not include Legionella, Aspergillus, and Candida auris, and some NTM. Flow cytometry uses a laser and dyes to identify the bacteria present in the sample. It counts the specific number of bacteria versus the number of colony-forming units. Expect fast results, same day or within 2 to 3 days. It is a highly accurate, quantitative test that can identify and detect all viable microorganisms, culturable and non-culturable cells. Non-culturable cells are live bacteria which will not grow or divide or form colonies. These cannot be detected using conventional HPC, but will be included in the bacteria count with this test. This newer technology has overcome water testing challenges. However, the advancement is reflected in a high price, up to 5 times more than HPC. There is still the inconvenience of shipping cold samples, and standards are still evolving, so expect inconsistencies as they become established. Real-time PCR, also known as quantitative or qPCR, determines the amount of a specific bacteria using fluorescence or light to measure DNA generation. This technology produces fast results within hours, reports within days. Water samples do not require refrigerated shipping either. It is highly accurate and can detect and identify all viable microorganisms. These advancements are reflected in the expensive test price. Note that qPCR is not used to detect a general bacteria count, but rather to detect one specific bacteria. It is commonly used for Legionella identification. Results are semi-quantitative, not an exact count, but a range of bacteria. In-office testing is convenient as you can test on site, minus the forms, ice packs, and shipping associated with lab testing. Because you test immediately after sample collection, there is less chance of inaccurate results. There is no time for bacteria to die or multiply, resulting in under or overestimated counts. Results are generally fast, varying between 24 to 72 hours, some tests as quick as 30 minutes. The benefit of a fast result is that you can be proactive. React quickly in the case of a failed test, saving the cost and stress of an office closure or downtime. These easy-to-use tests require no special training and are very cost-effective. Results are documented by your staff, and they're 100% confidential. In-office test results are not quantitative. Rather, they are a pass or fail based on a predetermined limit. In the case of Waterlines, 500 colony-forming units per milliliter. As the tests are not performed by specially trained lab technicians, there is room for human error. Not all test results are easy to read, causing inconsistency and confusion when recording. Bacteria detection is dependent on the test technology. An HPC dip slide test uses a paddle, grid, and HPC technology. Simply dip the paddle into the sample, then place into a vial to incubate. Some tests incubate at room temperature, others require a special incubator, which can be an expensive investment. Dip slide results are the longest wait among in-office tests, typically 48 to 72 hours depending on the brand. The test is very easy to use, however, understanding the results may not be so easy. Colonies in the form of dots grow on the grid during incubation. A pass or fail is based on visual ranges of colonies. The possibilities of bacteria combinations and quantities are endless, which can be difficult to decipher exactly what you're looking at. When compared to the HPC lab standard, there is a greater chance of false negative result, which means your test may not be a pass. Standard HPC is 7 days incubation. This test is only 2 to 3 days incubation, cutting the time for bacteria to grow and form colonies significantly, increasing the chances that the total bacterial count may be underestimated. The media, incubation time, and temperature may differ between dip slide tests, and thus the accuracy and detection of bacteria differs as well. Enzyme-based tests are easy to perform. Add sample water to a vial containing special dyes, shake, and wait. Bacteria releases enzymes into the water. These enzymes react with the dye, resulting in a color change. The brightly colored results are easy to distinguish and indicate a pass or fail based on a predetermined limit. Enzyme-based tests are quicker than dip slide tests, with results in 24 hours. There is a greater chance of a false positive result when compared to the HPC standard. These tests can be highly sensitive. For example, results can be affected when chemicals are present in the water. This may produce a positive or failed test, but not due to the bacteria counts exceeding the limit. Rapid tests have a few more steps than dip slides and enzyme-based tests. However, they are still quick and easy to use. A syringe is used to filter and cleanse the sample, which is then added to a test vial for incubation. Rapid tests get their name from their speedy results. These are the fastest in-office tests in dentistry, just 30 minutes. Incubation at room temperature produces color-coded results based on the presence or absence of bacteria. Aside from the color indicating a pass or fail, the color also indicates the number range of bacteria present. This test uncovers hard-to-detect bacteria like Legionella and NTM, making this in-office test the most accurate. Due to its advanced science, there is a very low chance of false positive or false negative results compared to the HPC standard. Regardless of whether you are collecting a sample or testing, always follow manufacturer's instructions for use to ensure the most accurate results. Remember, pass or fail, recording results is an essential part of testing. Reference the guidance of your regulatory bodies to ensure records are kept for the designated time. By understanding test options, limits, benefits, and results, you can make informed decisions based on your unique office goals and resources. Thank you.